And I'd like to introduce our next guest on the program. Dr. Mitch is in the studio, and I'd like to say good morning to Dr. Mitch. Good morning, Doctor.
Good morning. It's an honor to be a member or part of King Arthur's court.
Yeah, I was just on my throne right before you came in here, so there you go. All right, Dr. Mitch, you're new to me and the audience. You're a doctor of physical therapy, but beyond that, who is Dr. Mitch?
Who is Dr. Mitch? Okay. Well, Dr. Mitch was in physical therapy for over 25 years. And Dr. Mitch got very disillusioned with where healthcare was going to the point that I almost left the profession until a friend of mine told me about a facility that was for sale in North Cape May. At the time, it was called Professional Physical Therapy and Rehabilitation, run by Dr. Post. And we got along, hit it off. He went off to run the Newman College physical therapy program, and I ended up taking it over from him. And from there, I've been building it up ever since. And so I got a house out in Cape May Courthouse. For a while, I was traveling an hour and a half to get to work. Finally got a house. And my objective was to do physical therapy the right way, give the patients the time that they needed. I was tired of other places telling me to cut my sessions short. You know, it's still a business, this kind of thing. They wanted me to get people in and out. And I had enough of it to the point that I almost left. But I was never an entrepreneur by nature. But I knew that if I wanted to stay in my profession, this was the time to take the jump, the dive, the risk. So I decided to acquire the facility, and it's been great ever since. And I pretty much build my practice on word of mouth. You give people the time, you don't push them out, you work with them, you be flexible with them, and they come back, and word of mouth gets around, and that's why I'm still here today, and why I haven't been pushed aside as so many other private practices have been because of the changing environment.
And we invite our listeners to call in if you have any questions or comments for Dr. Mitch, 609-398-1020, 609-398-1020. So you've talked a lot about, we talked a little bit before you came on the air, and the fact that it's no real secret that many physicians have been bought out by big conglomerates and or hospitals, and they're not looking out for the patient, they're looking out for their bottom line, right?
Well, I think they care. I'm not going to say they don't care about their patients, but they're taking advantage, and I can't say I totally blame them either. They're taking advantage of the situation is what they're doing, and they're acting like business people, but it doesn't provide for fair competition. This isn't what capitalism was meant to be about. They basically saw a niche, and this is going on throughout the country. There's been studies on this. There's a monopolization occurring. They try to sell the idea that when they have everybody in one spot together, that it saves money and improves services. It's never been borne out in the studies whatsoever. There was a synthesis project years ago done. They've revisited that, and it does not improve quality of care, and it does not lower costs. If anything, when you have owned most of the physicians, which they've been doing is buying out the physicians, you have power, you have leverage. You have the leverage to get even more money for your services rendered. So a lot of hospitals out there are, and they're also, constantly asking for donations for things. And when you donate to somebody, you like to think you're getting something out of it. And
but a lot of these hospitals are considered nonprofits or 501c3. Are they tax deductible donations, or?
Well,
in that
I don't know,
instance?
probably, but I'm not that much up on all of that. But whenever you get money into an organization, it always makes it easier for you to do something else. And there's always ways to find a way to make part of your industry profitable. And, most areas throughout the country have been well served by independent primary care physicians and by physical therapists. And there was really no need there. So when you donate to somebody, you want them to use everything, all the resources to improve what they do themselves, rather than having to helicopter out patients to other facilities, make your hospital top notch where people won't have to be helicoptered out to other hospitals throughout the nation or throughout the region. So it's a battle for the private practitioners. Several thousand of them went out of business over the past few years because of the arrangements that are going on. And my company used to be called Professional Physical Therapy and Rehab. It's now called Physical Therapy and Balance Centers, spelled FYZICAL. Physical Therapy and Balance Centers. We say it's spelled different because we are different. And what we've done is we've banded together with therapists throughout the country in a sort of franchise operation. We have communications with each other. We are able to, and they're all owned by physical therapists. So rather than go to a facility that's just part of the employee lot where they get people in and get them out, everyone is an owner, so everyone has an interest in providing quality care. It's their name that goes on their facility. So, and the communication we have amongst each other allows us to improve quality of care, allows us to work on specialized protocols, and actually we get great deals on great equipment, and maybe that's why I'm probably the best equipped rehab center in my area, despite being a private practice.
How do you feel about Obamacare? I know that I've been hit over the head with fees because I have not signed up for the program. It's just not affordable for me. And I assume for a lot of our listeners out there, is this a complete disaster that I feel that it is? What's your opinion on that?
Well, I just got my premiums increased $200 a month myself, so I know what you're talking about.
Man, where are you supposed to get this money from? What, to grow off a tree or something?
Yeah, the deductibles are crazy right now too. I mean, and you have actually people coming in and they have such large deductibles they don't want to use the service. So I do my best to accommodate people, but competition is always necessary for quality of care. And it seems like everything is going the monopolistic route, which doesn't make any sense. When you own all the doctors, and they think they own all the patients, and a lot of patients just go where their doctor tells them to go, and they have to know that and understand they have a choice where to go for their physical therapy and other services. You can't just go where your doctor tells you to go anymore. You have to do your own investigation. That's why I say come into us for a free consultation. Take a look at our place. You'll see how things go. You can even talk to the other patients there. We don't have session time limits because I'm a privately owned facility in Cape May, and our number is 609-884-9800. If you come in for a free consultation, you're free to take a look at the facility, and we don't push people out. When you come into the facility, you're our guest. People become like family. And you might be there for 2 hours. I had a woman there for 5 hours recently. There's no time limitation. It's based on your motivation and your ability and desire. When I can see people directly, okay? And if you don't have a physician, I can help you find one, a good independent physician who's not bogged down by all
that
the
was my
corporate
next.
constraints.
I'm sorry to interrupt. That was my next question, Dr. Mitch.
Okay.
Physical
Yeah.
therapy is a specialty. Do you have to go through your primary care physician and then they would refer you to Dr. Mitch, or can someone go to you directly?
Well, legally, you can go to me directly, and there are many insurance policies that don't require you to go to your physician anymore, and thank goodness for that. But there's still a lot of them, maybe even the majority of them, that still require a physician prescription. I tell people that if you can't get into your physician or you need a good physician, I can help you find someone, and we can help expedite the process for you if you come to me directly. But you got to come in for a consultation first, and we talk. There are instances where it could save your condition. You'll benefit through your condition by seeing me right away, not waste as many healthcare dollars and time, and have to go as long in pain. Just for example, I had a patient that had something called an acute lateral shift. That's where he picked up a 2x4 and he ended up with really bad back pain. He walked in my office and the right side of his body was shifted to one side and his pelvis was in the opposite side. So there's some, theoretically speaking, there's like a wedging effect in the disc where all the fluid just built up on one side of the disc and he can't fight that obstruction. Now, if he had to go through the normal routes, get an appointment with a physician. What's the physician going to do? send them over for diagnostic studies. You have to make an appointment for that. Then you go to the diagnostic studies. Then you have to wait for the results. All this takes time, and when somebody has that kind of condition, they're on the brink of blowing that disc. When you see somebody like that, that needs to be corrected immediately. I don't need to have all these reports in order to determine what to do with somebody like that. If somebody comes and sees me and I work on them and I don't get anywhere with them, or they're not behaving what we call in a mechanical fashion, we call it mechanically inconclusive, that's the time when we want to send them out and be evaluated further for other issues. But we have some great physicians out there, and they pretty much know how things go. And if they need to do studies for certain cases, they should be able to operate freely in the best way that they see fit. And I'm always here for them to refer to me. But we do have direct access.
And physical therapy, I guess that sort of encompasses a lot of different areas. What are some of the services that you provide? And we invite people to go to your website, capemayphysicaltherapy.com. But you just mentioned you offer a free consultation, which I think is great, because we have an attorney, Chad Sherwood, who offers a free consultation also. And you have a lot of attorneys and doctors who are not doing that. Well, and it gives you a chance to meet with the doctor, sure, or meet with the professional person, and then decide whether, hey, I really like Dr. Mitch and maybe I'll use his services, or, get a better idea of a plan in action to help your problem.
Right, but when you come in for a free consultation, we discuss your condition, and it's sort of like a mini assessment. I get a feel for what's going on, because what you tell me gives me a lot of information about your condition. For example, if you have a back problem or neck problem, when I ask you questions during the free consultation, you're gonna tell me whether it's better when you sit, whether it's better or worse when you stand or when you walk. All this tells me about how gravity is influencing your symptoms. All this gives me some basic information as to what direction we're heading in. It gives me we can have good communication as to how we can help the situation. And you can also see what we have, how we're equipped. And you can even talk to other patients that are there. So yes, a free consultation is definitely the way to go. And if you wanted to set up one, call us at 884-9800. And you had asked me to talk a little bit about the services. Again, 884-9800. Our website is easy to remember. It's just capemayphysicaltherapy.com. You can spell physical the way we spell it or the way everyone else spells it. Physical is FYZICAL. capemayphysicaltherapy.com. But if you spell it the normal way, you'll reach us too, 884-9800. Now, we offer all kinds of services. We like to have a variety of things, because one thing may not work for one person but help somebody else, or we need a combination of things. Now, you've heard people advertise for laser therapy, which is great. We have the best laser therapy system in the industry. Ours is not a pulsed system like everyone else's who don't have what we have. Our system has continuous energy, so you get more joules of energy into the injured tissues to help with pain and inflammation. But it's not the only thing I necessarily recommend, or it may not be the first thing. You may call in, I want laser therapy. I heard does great things. But I might say, well, how about you come in, talk about your condition, we find out what's going on. Maybe it's not the thing we want to start off with right off the bat. If you don't have, it might be remedied through some other procedure, whether a manual therapy or an exercise or something else that might be sufficient. But if we see that we need more, we always have that option. I'm not here to be a salesman for people. I'm here to do the right thing. That's why I got my facility, to stay in this profession. So if you're in my office, I'm the one trying to keep you from leaving, whereas most places they're used to them, okay, bye, nice, have a good day, and they shove them out after an hour. Now, an hour might be enough for some people or for certain conditions, but wouldn't it be nice to have a choice? I've had people who've had total knee replacements, for example. They're trying to do everything within that hour, and they're being too aggressive with too much force to bend, say, a total knee replacement. And a lot of people don't heal that well. Some might be fine in that hour's time, but some people need a low load pressure applied at a sustained period of time, and not be having the clock judge the length of the session. They usually need more than that. So we don't just focus on the knee. We'll do balance assessment as well. Make sure that you got good balance. Maybe, we do a whole body approach. Maybe you need core training. You can't move your leg very well.
Let me jump in because we have to take a commercial break and
okay.
we're almost out of time. But can you stay for another segment? Because I think we haven't really hit on some of the services that you provide, and we'd like to do that. Can you hang out for...
Absolutely.
Okay, great. Dr. Mitch, who's a physical therapist. And Dr. Mitch, we were talking about what services that you provided, and we also invite our listening audience. You'll be here for about the next 10 minutes. If you have any questions or comments, 609-398-1020. But before the break, we said physical therapy encompasses a lot of different aspects, and you were going through some of them before we had to take the break. So let's get right back to Dr. Mitch, and good morning to you, sir.
Good morning to you. And yes, this is Dr. Mitchell Hackerman. I'm with Physical Therapy and Balance Centers in Cape May. That's spelled FYZICAL. And we're at CapeMayPhysicalTherapy.com, CapeMayPhysicalTherapy.com, 609-884-9800. Just want to make sure you have that if you wish to have a free consultation. Services we provide, we pretty much treat all kinds of orthopedic cases, pre-surgical, post-surgical. We offer a variety of treatment approaches. And as I said before, we're very well equipped, probably better equipped than any other place in the area. People are very surprised when they enter our office and see what we have. We have something called the Safety Overhead Fall Protection System, SOS we call it, Safety Overhead Support, where if you have any balance issues whatsoever, or if you're rehabbing post-surgically, you need to be able to ensure you restore your balance and do it safely. This allows you to have a harness on you with a cord that attaches to the ceiling. I mean, it could hold like 2 elephants. And it makes a huge difference in balance training. When somebody starts to fall when they're training, rather than the therapist having to stop them from falling and injuring themselves, I can let them go, because that way they get to train their protective responses. So if you start to fall, you need to make sure that you're able to protect yourself and get that foot out there and stop yourself. And that makes a huge difference. I treat a lot of vestibular patients, people with vertigo. Balance deficits can come from a variety of reasons, and we do a thorough assessment. And as I said before, we treat the whole body. We offer laser therapy, the best one on the market, which has continuous energy. It's not pulsed like other ones are, which means you get more joules of energy into the damaged tissues. It helps with the healing process. Helps accelerate healing, helps with wound healing, proper healing. And as I said before, all of our treatments are adjunctive to other things you might need. We have something called an ATM2, and that's not the money machine. It's called Active Therapeutic Movements. And it's a standing table that has straps on it that compresses your body and stabilizes your body. And we tighten those belts around your body in different ways to position your body so it helps you become pain-free if you have a certain type of back problem. And when we get rid of the pain while you're in the machine, we exercise and train your body and your core in that machine. And oftentimes the result is when you step off of it, you have no pain and you can bend better. Now, if you go to my testimonials page, or if you go to my website, you'll see people using this machine and other treatment approaches. You'll even see physician testimonials and patient testimonials, a ton of them. And you'll see this machine in action and some other things. And what I did, like I set up my laptop and just aimed it at somebody who was complaining of pain and just let it roll while I was treating them. And you can see the huge change instantly. We do something called augmented soft tissue mobilization. It's called ASTYM, ASTYM. It's similar to a procedure that a lot of people are aware of called Graston. It's just that we use resin composite tools rather than metal tools. We have the philosophy is, why use a Mack truck if you can get the job done with a Volkswagen? It's very good at treating different types of soft tissue injuries. Also part of our balance training, we have a Biodex Balance System SD, which does computerized balance testing as well as training. You can do some fantastic balance training with that as well. I'm certified in something called LSVT BIG, which is a Parkinson's program. And it's been well researched, very well researched. And what's great about my certification in LSVT Big for Parkinson's is that I can use my safety harness system with it. Okay, so people are going to get an extra sense of, or more aggressive or more intense balance training out of it.
Who
Go ahead.
who needs physical therapy? Who is someone who would need physical therapy?
Well, any people who have any kinds of aches and pains can use physical therapy. People who want more medically based or rehab based direction. A lot of times when people have aches and pains, they just might do like yoga. Like for example, yoga is a great exercise program. I would never dissuade anyone from doing it. But if you have a back problem, some of those movements can actually harm you. Okay. That's why it's good to come to me first. Let me treat it, stabilize it, and let you return to that at a later date. Sometimes some of the movements can be very good, and you might, do well, but it all depends on the individual condition. The thing about coming to me is, with regard to various musculoskeletal problems, is I can help determine the stability of the problem and help you determine what you can safely do. Rather, a lot of people are fearful of doing certain things. They don't know what to do. And I discuss that with you. When you come to me, you understand why you are having the problem you're having from a very logical, mechanical perspective. And I just don't say, well, do this or do that. You're going to understand why I have you do it. It's not just do this or do that. You're going to know in your mind's eye why you need to do what you're going to do. And you're going to be able to develop better self-treat should you have a recurrence of any kind in that regard.
What is the difference between your physical therapy practice and maybe something that somebody would get in a hospital or when they leave a hospital? God bless her soul. My mother passed away going on 4 years, and she had some issues, and it was a thing where she had a very tough time doing physical therapy, and she didn't like the person instructing her. She thought that they were a little bit too hard on her.
Okay.
And I mean, one of the things that you've talked about in our segments is that you don't have to go somewhere where you don't feel like that they're treating you well, or that
or just because the doctor sends you
Right.
there. Now, you got to question the doctor. You can't just go where they send you anymore. It's not like the old days. There are a lot of great doctors. They do want to do what's best. They will send you to where they think it's best, but there are doctors who feel obligated to their employer. And so when they send you, go, okay, you'll get a call, set up the da-da-da. It's always, if they're always sending you to something affiliated with their hospital, you know, pretty sure what's happening here. But you make the decision. You want to go look at their place, look at their place. Come to ours and compare. And the thing is I'm a private owner, so I have pride of ownership. Okay, and so do all the physical locations throughout the country, and that's why we sort of banded together. When you come into my office, we don't have an atmosphere of trying to get you in and get you out. As I said before, I had a woman here for 5 hours and they didn't even realize how much time had gone by. And because it's a very enjoyable, fun, festive atmosphere, we actually socialize and encourage it, and it really helps with the healing process. There's a lot of fun, a lot of joking and everything. It goes along hand in hand. It's funny because I've had people say thought I was Mr. Joe Serious when I evaluate them, which I am, because I really want to know what's going on and figure out what the problem is and know how to treat you. But once I'm comfortable with what we're dealing with and what direction we have to go in, I become a different person. And people have been very surprised by that. But it's better to come into a facility where everything's pretty laid back, and you don't have to rush through. You can take breaks for as long as you need to in between sessions, so you don't overdo it. And you'll see that I'm the one who actually tries to get people to stay longer as opposed to trying to kick them out. And people are often very surprised by that, and they even say that, like, I've never seen anything like it. So as I say out there, if you're interested in a consultation, please give us a call at 609-884-9800, 609-884-9800. Check out our website, which I'm in the process of revamping, so the one you see is not going to be the one you get later down the road, CapeMayPhysicalTherapy.com.
And of course, for the free consultation, there's no referral necessary from
No.
any doctors or whatever. You can just go there, and a lot of people do feel like, hey, I have to go to this particular physical therapist because that's what the hospital said or the doctor at or whatever, and that's not the case.
No, of course not. And people assume that because it's a hospital, or they automatically they have like hospital equipment or hospital this or hospital that. It's not like that in outpatient rehab. There's a lot of skilled therapists out there, and they take a lot of courses to get even better skill. One of the biggest differences is I get to apply my skill. Where I used to work in the past, it would take me maybe 3 to 5 visits to do what I can do in one visit simply by allowing the patient to stay longer. Okay? So I'm not just going to say, okay, well, we did what we could. Let's try something else when you come back, and we'll see if we can get closer. No, I'm going to keep working with you until I'm satisfied. And if I exhaust all avenues, then I might say, okay, well, come back the next time. But you will have been in my office for quite a while. No, I don't force you to stay that long. You just have the option to stay that long. And you know, that enabled me to stay in my profession. Whereas before, I was looking at other things because I just didn't want to deal with what was happening out there. I didn't want to be in an operation where they had to get people in it and have to be not even communicate with one another. Go, you sit over there, you sit over there, you can't talk, or any of that kind of stuff. And as a private center, I have a lot more flexibility with that sort of thing.
Well, we appreciate you coming in this morning and shedding some light on physical therapy, and I think it's just outstanding that you're offering a free consultation at 609-884-9800, 609-884-9800. So if you're out there and Dr. Mitch can take a look at you, it's completely free, and then decide whether you will use his services or what have you. But I think it's a great public service for any professional to offer an initial free consultation, because look, some people aren't comfortable with other people, or they don't like the demeanor of somebody, and
well, that's true.
It's a great opportunity for an introduction, and there's no cost to the patient.
I tell people those who compare us will choose us. I'm fully confident in having you visit any facility you want. You come and see what we offer, what we do, and they typically choose us. Sometimes it can get busy because of the time we allot to people, but it's a fun, festive atmosphere, and there's absolutely no way you're not going to get more in my facility with each session than you will at any other facility out there.
All right, check out Dr. Mitch at CapeMayPhysicalTherapy.com, and the free consult number 609-884-9800. What are your hours, your office hours?
We're open every day, Monday, Wednesday, Friday. We work till 6 usually. Tuesday and Thursdays we work from 9. It's all like from 9 onward, 9 to maybe 1 or 2. But we can make special accommodations if we need to. We have flexibility. As I said, we're private owned facility. We're not clock punchers here. We're not clock watchers. So, we try to work things out to best accommodate you. So please give us a call at 884-9800.
All right, Dr. Mitch, been a pleasure. Hopefully we'll see you again soon, and shedding some light on physical therapy, and maybe some people have a different idea about what it's all about.
Make your own choice. That's
Exactly.
the bottom line. Make your own choice.
All right, we'll be right back. The King Arthur Radio Show. Thanks to Dr. Mitch.